Okay, this is Dr. Bishop, and I decided not to show my ugly mug on the screen this time. You just look at the PowerPoint slides, and I'm going to do a hopefully not too long of a PowerPoint presentation on the McAndrews scale. This is a scale that I wanted you to complete before doing anything else in this section. It's a I don't know how many items of 49 item scale, which has mostly items that don't look like they relate to much of anything, but turned out to be a scale that measures potential to become alcoholic or alcoholism. And it's got pretty good reliability and validity. We use it as a screening device. So anyway, this scale was developed by a man named McAndrews, who named the scale after himself, and it was developed by comparing responses on the MMPI, which is otherwise known as the Minnesota Multiphasic Personality Inventory, of non-alcoholics to a group of outpatient alcoholics. Now, you may recall that the MMPI was an objective paper and pencil 567 true-false item personality inventory that was covered in Chapter 3. You might want to refer back to see what that scale is all about. In any event, it had 567 items, and after they got done with constructing this personality inventory, they went back and they got, like it says here, a group of alcoholics and non-alcoholics. They had them take the test, and they selected items to go on the McAndrews scale that reliably discriminated between the alcoholic and non-alcoholic group. So generally, if an alcoholic, maybe it'd be a simple item like, I enjoy looking at the ceiling. And 80% of alcoholics would say yes, and maybe 20% of non-alcoholics. So that item would then become part of the scale. So the scale itself has 49 true-false items, and most of them don't look like they have anything to do with alcoholism. When you score it, after you take the test, there's a key included there on Blackboard in that section. Go ahead and score your MAC scale test and find out what your score is. But generally speaking, the average alcoholic scored approximately 28 on the MAC scale, and the average non-alcoholic was much lower, 15 to 23. The scale is now sometimes used as a rough screening device, with scores above 24 being high and scores of 28 being very high. The scale appears to have good validity. That is, it seems to be correlated and predict alcoholism, but it's far from perfect. So you would never use just a single measure of anything, let alone a scale, to diagnose alcoholism. However, I have found that it is useful. They did find that if you took like 200 alcoholic or 100 alcoholics and 100 non-alcoholics, and you just mixed up their MAC scale results, and if they had 24 and above, and you threw them into the alcoholic group, and below 24, they found that they were 84% correct in predicting alcoholic from non-alcoholic on using this MAC scale. So the items do not have face validity. That is, they don't look like they're measuring alcoholism, which makes it a useful test, because if somebody has a drinking problem or alcoholism, will often just lie about their drinking. So this is a tough test to fake. It's not clear what the scale is, or what the direction of the items, how it will be scored. Okay, if used for screening, you take people that score high or very high and follow up with an assessment by interview. And I'll talk about some of the criteria used in a subsequent PowerPoint lecture. So I like to have students take the test and score it, but I don't have them share the results with me. So my thinking is that if there's a problem or potential future problem, it's important to know this because, my experience, and I did work in an alcoholism unit for 2 years, is that alcoholic problems affect almost all areas of a person's life, and alcohol problems don't go away on their own. So, again, I've got a more extended lecture on alcoholism where I include my top 10 after David Letterman's top 10, which gives further clues as to whether a true problem exists or not. I just have found that those specific criteria are useful questions to get a flavor for whether there might actually be a problem. However, even if you score high, get a score of 32 or 28 or 24 or whatever, I have seen a number of people with high scores that don't have an addiction or alcohol problem. Typically, or oftentimes, those people may be children of alcoholics, but sometimes you just don't know why they scored high. The test seems to measure certain personality tendencies, extrovert, outgoing, a little impulsive, maybe a little bit antisocial. In any event, that could also be a reason why people can score high but not be alcoholic. However, it is also true, although not, you got to be careful about inferences, that people that actually do have personality disorder or an antisocial personality disorder, psychopathy, or whatever you want to call it, often also have alcoholic problems. It's important to discriminate that because most alcoholics don't have a personality disorder. And treating an alcoholic with personality disorder and one without is a huge difference in treatment strategy and prognosis. I will say I haven't seen anyone with a score of 21 or less who is alcoholic. So if you scored low, the chances are that you're not alcoholic. Most of the time for most people, it's pretty clear whether you're alcoholic or not, particularly if you're not. It's just when people get in the mid ranges of drinking, and a lot of people get confused about whether somebody's really got a drinking problem or not. And this is the thing I want to kind of clarify with some of my input. I have found, and I'll just mention this, that mental health professionals have virtually no training in diagnosing alcoholism, which is a major deficiency, I think, in training. I didn't have any when I went through my PhD program. Psychiatrists don't really get any training to speak of. Medical doctors don't. Social workers. So I think, with a base rate of 10% of the population with drinking problems of some sort or another, this is a major deficiency. So I'm trying to rectify that a little bit in my own little way. It's worth noting that the MAC scale has predictive and empirical validity. Not only does it might suggest a current problem, but it also might predict a future one. It doesn't look like a good measure of alcoholism because it has no face validity. It doesn't ask questions about drinking or substance use. But it actually is a pretty good measure. It does have what we call empirical or statistic or predictive validity. It's correlated with current and future use and problems. It's also noting that the base rate, again, is about 10%. So when you get a class of 30 people, even in college, you're going to have maybe 3 or 4 students that score in the high range. And my guess in a class of 20, you might have a couple people score in the high range. The other point I should make is that when you do find alcoholism being present, it's important to recognize it's a primary problem in the sense that if it is not treated, any other problems that exist will not resolve. For example, depression or marital problems. I saw a woman who had a child who was 17, was having all kinds of behavioral problems, very serious kind of thing. And after I got into discussing, kind of a broad perspective of the problem, it became clear that her husband was alcoholic. She didn't know it, but he had been alcoholic for 20 years. They'd have severe marital problems, had counseling for a full year on marital problems without anybody recognizing that he was alcoholic, and of course nothing changed. And eventually she ended up in the emergency room because he had an outbreak when he was drinking and had personality change and got aggressive, and he actually broke her, fractured part of her spine or pelvis in an outrage. And also depression. Some people will get depressed if they have a drinking problem. That can often lead to depression. It's comorbid with depression. So, and as I mentioned earlier, physicians, psychiatrists, psychologists, they have no training and are often unreliable in diagnosing alcoholism. It actually is very hard to diagnose alcoholism accurately unless you have specific training and some background and know what questions to ask and what to look for and what to not be misled into focusing on. Okay, I'm going to stop there, and hopefully that'll be useful.